Hey everyone and welcome. Today we're going to talk about something really important. What happens when your doctor tells you that you need major orthopedic surgery? I know, it's a pretty scary moment, but you've got way more control here than you might think.
So picture this. You just left the doctor's office, and that one phrase is just ringing in your ears: you need surgery. Doesn't matter if it's a joint replacement or some complicated spine procedure, the first thought that probably pops into your head is this really the only way?
And you know what? That feeling of being totally overwhelmed is 100% normal. It's a massive decision, and the weight of it can feel just immense. But here's the thing. You don't have to make that decision in the dark. There's actually a clear path forward, a way to cut right through all that confusion and really take charge. It's all about getting a second opinion, and we're going to break down exactly what that means right now.
Okay, so a second opinion. It's not about doubting your first doctor or saying they're wrong. Not at all. Think of it more like doing your homework for your own health. It's just having another expert, someone independent, take a fresh look at your case to double-check the diagnosis and, this is the crucial part, to explore every single treatment option out there.
Because it really all boils down to this, right? Your health decisions deserve to be made with total confidence and clarity. The whole point is to move forward knowing you've picked the absolute best path for you without any of those what-if doubts lingering in the back of your mind.
So how do you know if this is the right move for you? You might be asking, is this something I should do? Well, there are some pretty clear signs that a second opinion could be, incredibly valuable. Let's dig into what those are.
Yeah, there are a few big triggers. The most obvious one is if you've been told you need major surgery, like a hip replacement or spine surgery. But it's also a great idea if you just have some worries about the risks involved, or maybe you just want to know if there are options that don't involve going under the knife. And hey, even if you've already started a treatment, but your symptoms aren't getting better or they're getting worse, that is the perfect time to get a fresh set of eyes on it.
Okay, let's say you're on board. You've decided to get one. What does that actually look like? Well, the good news is it's a really structured, patient-friendly process. It's not going to be chaotic or intimidating, I promise.
The whole thing is incredibly thorough. It kicks off with a really deep dive into your medical history, followed by a new physical exam. Then, the specialist takes a look at all your existing scans, your x-rays, your MRIs, but with a totally fresh perspective. And that all leads to the most important part. They'll compare the original plan against all the other possible alternatives. And then, they'll sit down with you and clearly explain every single option on the table.
All right, let's just get to the elephant in the room. This is probably the #1 fear that holds people back, right? This idea that you're somehow betraying your doctor or questioning their skills. So, what's the real story here?
The answer is a simple, straightforward no. Seriously, any good doctor wants their patient to feel 100% confident and comfortable with their treatment. Getting a second opinion is totally standard, it's respected, and honestly, it's often encouraged. It just shows that you're an active participant in your own healthcare.
Okay, so your doctor isn't going to be offended. But let's be real. Is it worth the effort? Does getting another look ever really change the outcome, or is it just for peace of mind?
Oh, absolutely. This is where a second opinion can be a total game changer. A lot of the time, surgery isn't the only answer. So many patients end up discovering really effective non-surgical options, things like targeted physical therapy or new pain management techniques that can actually delay, or in some cases, completely avoid the need for an operation. So, after all is said and done, what's the ultimate goal of this journey? What's the destination we're heading for? Well, it all comes down to one simple thing: making a decision that you can truly feel good about. I mean, this slide just lays it out perfectly, doesn't it? Look at the difference. On one side, you've got a path filled with uncertainty, with limited info, and just those nagging doubts. But on the other side, you've got confidence. You've got the peace of mind that comes from knowing you looked at every single possibility and you're making a genuinely informed choice. And that's the bottom line. A second opinion does so much more than just give you more information. It actually shifts the power dynamic. It takes you from being a passive patient and puts you in the driver's seat of your own health journey. It empowers you. So we'll leave you with this final thought. When you're facing a huge health decision like this, what's that certainty really worth? What's the value of knowing, without a doubt, that you made the absolute best choice for your health and your future? It's something to think about. Thanks so much for joining us.